A Monteggia fracture is a concurrent fracture of the proximal third of the ulna with a dislocation of the radial head due to annular ligament disruption. The mechanism of injury is an anterior or posterior directed force to the proximal forearm. A type 1 fracture is an anterior radial head dislocation and an anterior ulnar angulation. This is the most common type of Monteggia fracture. A type 2 is a posterior radial head dislocation and a posterior ulnar angulation. The pain will be localized to the radial head and proximal ulna, as well as there being crepitation over the radial head and proximal ulna. The patient will be dysfunctional with pronation and supination, as well as elbow flexion and extension. You will notice an intact isosceles triangle. You will perform standard of practice fracture tests. You will want to rule out radial nerve involvement. Treatment will differ between children and adults. In children, it is more conservative with a radial reduction and a posterior arm splint. In adults, you will see an open reduction with an internal fixation. Other fractures that you might see at the elbow joint include a supracondylar fracture as well as an olecranon fracture.